Thank you, Brett. Thank you, everyone, for coming. And before I get started, I just wanted to say a special thank you to Brett, because you saw us when we were just a concept on paper. And we wouldn't be here today with the progress that you're going to hear about if it wasn't for your help. So thank you for all your support and everything that you do for all entrepreneurs in the Northwest. So, we know video games can captivate. Can they go one step further and improve health? LiteSprite builds games to manage chronic health conditions. The data we collect from our games, phones, and biosensors delivers insights to players and clinicians. Based on a decade of clinical research at leading institutions, we are part of the emerging field of healthcare entertainment. We've received financial awards from the Robert Wood Johnson Foundation, the U.S. Army, Livestrong Foundation, and Singularity University in South by Southwest. I'm Swatee, founder and CEO. And this is Emma. Like people in over 60 countries and 40 million Americans, oh wait a minute, it's not working. There we go, oops. She has anxiety and depression. Our first mobile game, LiteSprite, supports her work with a therapist, or she can use it on her own. Her employer or insurance firm gives her access. She downloads it from the App Store. Easy. In LiteSprite, Socks the Fox is Emma's therapist in her pocket. Socks guides Emma through proven evidence-based cognitive behavioral exercises that get her better. Emma journals. She visualizes, she breathes, and she meditates. The more she does these activities, the closer Socks becomes to becoming a Zen master. And it works. We are showing strong engagements, and players are, in fact, getting better. I'd like to share with you some player feedback that we've been getting from a group of Medicaid patients that were using a beta version for only 3 weeks. Everyone should start downloading LiteSprite. It's life-changing. What's been helping me a lot is LiteSprite. When I'm having a really bad day, it really helps me. It's really cool. You all should get it. I'm no longer depressed. Ever since I started using LiteSprite, I've been thinking and feeling better. Thank you. And it's my inspiration every morning. Let's see. Oops, there you go. So this is an example of the back-end data that we're collecting, and what you're going to see here is that players are self-managing care, and they're also coming to LiteSprite when a therapist isn't available. This is extending care beyond the clinic walls. Insurance firms and employers, our customers, spend over $250 billion a year on our target segment. They are actively looking for low-cost solutions to meet legislative mandates, lower the cost of care, and drive top-line revenue growth through branded experiences. They pay us an industry-accepted licensing fee, which is less than a round of medication or a therapist visit. For every 1 million people that have access to LiteSprite, we can reduce costs by $18 million a year annually. We are currently in clinics, including the U.S. Army. And imagine, instead of a drug, your doctor prescribes LiteSprite. So, whoops, let me go backwards. So we're a team of clinicians who have been Harvard and Stanford trained. We wrote Nike's first wearable technology patents. We're founders of the original Xbox project, and we're data scientists. If you know someone that could use this, or you want to try it out yourself, we're in a public beta, so go to our website or give us an email. LiteSprite gets people engaged. Engaged people get better faster. Thank you. Any questions? Do we have time for questions? Yes. All right. Yeah, so the strategy is to get through clinics and show the efficacy. And so what we've been finding is we're getting pull from clinics and providers and hospitals, including like Swedish. So which was surprising to us. We thought that would be the last place. But with the insurance, if you can show that a provider is using it or a clinician, then they're going to be more apt to adopt it. So thank you. Yeah. Yes.
Have your looked at the work of Shane McGonigal and Super Better?
Yeah, she knows about what we're doing.
Yeah.
Yeah. Thank you. Any other questions? Okay. No, wait, someone's pointing over. Oh, okay, yeah.
What's your current patient base size?
We currently have about 100 active users on it. The demographic is ages 22 to 68, about 1.5 to 1 women to men.
Do you have anybody coming off antidepressants? How's the point feeling?
It's too early to tell right now. It's only a 6-week program, so I wouldn't expect anyone to be coming off of drugs if they've been on it. In some of the trials we're running, we're expecting them to be stabilized on meds if they are on meds. So stress, rheumatoid arthritis is another one, migraine headaches is another one, diabetes is another one, cancer is another one, because of the comorbidity that's associated with it. No, not really, because that's cognitive load, which is different.
How do you handle the privacy concerns and kind of like working with the provider who has access to the data that you're using?
Yeah. So we're a management tool, so we don't diagnose anything. So it's a management tool, first of all. We're HIPAA compliant for the military as well as any of the provider systems we go into. So we meet all their criteria.
So is it just the user that
Currently, there's a clinician dashboard that they can have access to, but that, again, will also follow HIPAA compliance. If the patient does not allow access, then we don't give access. So that's...
One more question.
Is there a reason behind your guys' styling of your illustrations?
Yeah, it's interesting. We always get that question, and it's a good one because the art style is intentionally very non-hyper-realistic because it's simplified to make it a more soothing and just a more straightforward and approachable experience. It doesn't look hard to do. So that's why we use that.
Thank you, Swatee.